These are all the medications you need and don't need for going to high altitude, when you should take them, and what I personally take when climbing above 6,000 or 8,000 meters. First is the most popular, called acetazolamide or Diamox. It is a preventative high altitude medication which decreases the level of CO2 in the blood by preventing the kidneys from absorbing carbonic acid and making the blood more alkaline. If you plan on taking it, you should start at least 24 hours before going to high altitude, or if you plan on being at high altitude for an extended period of time, then you should take it for 2 weeks prior so that you can identify the side effects the medication causes and to potentially get over the side effects such as loss of appetite or excessive urination before you reach high altitude. If you start taking it while already experiencing altitude sickness, you will not know which symptoms you are experiencing from the medication and which are from the altitude itself. If you have an acclimatization schedule where you don't go more than 500 meters a day up in elevation, then I recommend not taking acetazolamide, as it is very intense on the kidneys, and if you are going above 7 or 8,000 meters, then it can be a trade-off, as you will be able to move faster, but your kidney will be failing faster. It is actually quite common for pee to turn black after being above 8,000 meters. Acetazolamide was in the past called cheating by many purist climbers, but its stigma has long since gone and nobody really cares anymore if you take it or if you don't. A prevention dosage of 125 to 250 milligrams every 12 hours is taken, or a treatment dosage if you have acute mountain sickness of 250 milligrams is taken every 12 hours. Second are the boner pills, Tadalafil and Sildenafil, better known as Viagra. Both are used to treat high-altitude pulmonary edema, or a buildup of fluid in the lungs. This is the most common serious altitude sickness, and either medicine should be taken as soon as it is suspected. Tadalafil is by far the better choice, as it is faster acting, and there is less chance of experiencing a priapism while taking it. They are vasodilators and increase the blood flow going to the lungs, which allows for the parts of the lungs which are not filled with fluid to more efficiently take in oxygen. It can be taken preventatively, but I don't recommend doing so. It could increase your risk of frostbite, for example. Prevention and treatment dosage would be 10 milligrams every 12 hours. Next is salmeterol, which is a bronchodilator. It works much in a similar way as Tadalafil, except it is more targeted and focuses on only the lungs rather than the entire body, and it is a longer lasting medication. It is not used for the treatment of HAPE, but rather exclusively for the prevention of HAPE. The dosage is 125 micrograms inhaled every 12 hours, and avoid mixing it with the next medication on the list, which is nifedipine. Nifedipine is a calcium channel blocker which lowers your blood pressure, and this prevents or treats HAPE because when you have high blood pressure and vasoconstriction in the lungs, it causes your capillaries, the small blood vessels, to leak fluid, which causes the edema. Relieving the pressure on these blood vessels stops the leak and allows for better oxygen exchange in the lungs. Nifedipine shouldn't be taken with salmeterol, but should be taken with Tadalafil. A prevention and treatment dosage of 30 milligrams sustained release every 12 hours. Next is dexamethasone, which is a powerful anti-inflammatory that reduces brain swelling. It is used for the prevention and treatment of HACE, or high-altitude cerebral edema, where fluid is building up in the brain. It is described as making people feel superhuman, and most climbers don't recommend taking it unless HACE is present, as it can mask the symptoms of HACE developing, which could make the situation worse, and also as the medication wears off, it is common to have a come down and lose energy. Dex is a controversial drug, and people taking it while not in an emergency are often scrutinized for cheating in a risky way and pushing their bodies past their natural limits. You know somebody has HACE rather than the less detrimental acute mountain sickness when they are stumbling, acting almost drunk, and unable to remember who they are or what they are doing, and experiencing hallucinations. A prevention dosage of 4 milligrams every 12 hours, or a dosage for AMS treatment of 4 milligrams every 6 hours, and a HACE treatment of 8 milligrams once, and then 4 milligrams every 6 hours is required for dexamethasone. Next is ibuprofen and paracetamol. Everyone is typically familiar with them. You should use paracetamol for headaches and ibuprofen for all pain below the head. Be mindful that they both add extra strain on the kidney and liver, so using them should be reserved exclusively for the descent and not to push above your limits. If you're in a rather large amount of pain, like for example my foot was bleeding while descending Lhotse, then combining these medications works better than taking just one. Oxymetazoline, also known as Afrin, is a nasal spray vasoconstrictor which alleviates the blocked nasal passages that frequently occur from the irritation of dry and cool air at altitude. I recommend carrying some for the summit push and using it a day or two before. It can make a massive difference in the ability to breathe consistently through your nose and thus reduce lung inflammation that comes with mouth breathing. However, it can be addictive and cause damage to the nose if used for more than 3 to 5 days. Cough medicine such as codeine or Detus should be in a medical kit but used sparingly. Detus is commonly prescribed at high altitude for dry coughs like the infamous Kumbu cough, and it is effective at reducing the inflammation, but it will not normally remove it entirely if the person remains in the same environment. It can also cause drowsiness and reduce energy, which could affect recovery while at high altitude. It should be used, but used sparingly. It is typically combined with paracetamol. Caffeine is used by most mountaineers for extra focus and energy. However, my take on this might be a hot one, and that is that caffeine should be only used while descending. During an expedition, you should totally avoid caffeine because it reduces your uptake in so many nutrients, but most critically iron. Caffeine blocks your vitamin C, which in turn reduces your body's uptake in iron. Iron is critical for producing the much needed red blood cells at altitude, and you should avoid caffeine until you are descending from a summit push. This also ideally means that your body has a reduced tolerance to caffeine and you will have much more of a benefit from caffeine. Coca leaves or coca leaf tea are a common remedy for altitude sickness in South America. They work by alleviating nausea. However, some studies say that 51% of people taking coca leaves experience AMS anyway, and that they don't use any other altitude sickness medication. From personal experience, they can help or hinder a trip based on dosage. They can cause or alleviate nausea. They can mask the symptoms of HAPE or AMS. They dehydrate you and take away from your appetite. They shouldn't be mixed with caffeine or acetazolamide for this reason, and because of this, I wouldn't recommend taking coca leaves. There are better medications, but because of the lack of literature, it should be taken with caution to see how it affects you personally. Also, don't confuse coca leaves with cocaine. Taking cocaine at altitude will increase your risk of HAPE and HACE, dehydrate you significantly, and increase your heart rate on an already stressed out heart. Next on the list are ADHD medications. If you are already taking a prescribed ADHD medication, then continue to do so. However, if you plan on taking one to give you an extra boost while at altitude, this is a bad idea. The typical stimulants like Ritalin and Adderall will dehydrate you and increase your blood pressure while masking HACE symptoms. Atomoxetine, also known as Vinase, will dehydrate you while also increasing pulmonary blood pressure, which could increase the likelihood and the severity of HAPE, as well as straining the heart. Imodium is sometimes used during a summit push to prevent the need to urinate or poop. It is taken by many climbers to avoid needing breaks or exposing their body to colder weather, especially on 8,000 meter peaks, and it can also combat the excessive urination that Diamox causes. It's normally used for food poisoning, so either way, it should be in your medical kit. Nicotine should never be taken at altitude. It is a vasoconstrictor which will reduce your blood flow, increase the likelihood of cramps and frostbite, as your extremities will receive less blood flow. Methamphetamine used to be used in emergencies. However, it actually increased the risk of HACE while also masking the symptoms because it increases the blood-brain barrier breakdown, which allows for more fluid to fill up the brain. My high-altitude first aid kit contains Tadalafil, paracetamol, ibuprofen, dexamethasone, oxymetazoline, acetazolamide, and Imodium. From personal experience, attempting to reach the summit using only oxymetazoline and maybe Diamox is a good idea, and then when descending, use paracetamol, ibuprofen, and caffeine as needed, with the rest of the medications being used only in case of emergency. This video focuses only on the medications that should be used at high altitude, but I will put together something about supplements for high altitude in the future. I have journal articles referencing most of the medications that I've talked about. However, some of this is based on anecdotal experience, and I'm not a doctor, like, really not a doctor, so this is just based on journal articles and experience.